This is ASH News TV. The 2018 Scientific Program co-chairs offer a preview of the best of ASH.
In the hemoglobinopathies, we're going to highlight two clinical studies that I really think have the potential of changing the management of disease. One of them is a study of a new drug for beta thalassemia that actually increases hemoglobin and decreases the need for red cell transfusions for transfusion-dependent patients. And the other one is also a new therapy for sickle cell disease that significantly improves all the parameters of hemolysis and increases hemoglobin and decreases vaso-occlusive events.
One of the most exciting abstracts from my perspective from working on the myeloproliferative diseases is secreted mutant calreticulin protein as a rogue cytokine. So that was covered in the plenary session, but I thought it was important to reiterate the excitement of the novelty of that work.
This year's 7 late-breaking abstracts represent outstanding studies that were completed after the general abstract submission deadline. Here's a look at some of the exciting research selected by the ASH Program Committee for this highly anticipated session.
About our hemostasis thrombosis community, one of the big risk factors for cancer patients is the development of DVTs and PEs. This was a trial with prophylaxis with rivaroxaban in patients with high-risk patients with malignancies who are at high risk for DVT and PE. And they were given prophylactic doses of rivaroxaban and showed that it could greatly decrease the risk of DVT and PE. Another extremely exciting trial is in multiple myeloma with the drug daratumumab. So this was a large randomized controlled trial that, again, I think is going to be very practice-changing. This was in patients who were older, who were not candidates for bone marrow transplantation, and they were randomized between standard of care, lenalidomide and dexamethasone, with or without the monoclonal antibody daratumumab. And what the investigators showed was a marked increase in progression-free survival by adding daratumumab. The number of complete remissions and deep complete remissions was double in the daratumumab arm. And again, this is showing probably a new standard of care for the treatment of multiple myeloma.